birthday?
My name is Abigail Hall and my date of birth is 7701.
Okay. Okay, I'm gonna do your head to toe assessment today. We're gonna start out by asking some medical questions about your health history. Do you take any medications currently?
I do not.
Okay. Do you have any allergies?
I just have an allergy to Tramadol with, I break out in hives.
Okay. All right. Have you had any recent surgeries or hospitalizations?
No surgeries or hospitalizations.
Okay. Do you drink any alcohol, use tobacco products, any illicit substances?
None of the above.
Okay. All right. So I'm going to start with your vital signs.
Okay.
Mm. 126/72. 97 oxygen, 84 pulse, and your respirations are 14. Are you having any pain?
No pain.
Okay. All right. All right. I'm gonna put some gloves on, and then I'm going to take a look at your scalp and hair. All right, I'm just gonna look. I'm gonna look for any masses, indentations. I'm gonna make sure you don't have any skin breakdown, nothing like that. All right, everything looks good there. I'm gonna move down and I'm gonna palpate your temporal arteries, okay?
Okay.
All right, those are both 2+ and normal. And now I'm going to move down and we're going to assess your trigeminal nerve. I'm going to palpate back here, and I need you to clench your teeth for me. Good, okay. And I'm going to move down here, and I need you to try to open your mouth against the resistance of my hand. Cool. Okay, now I'm going to palpate your sinuses. I'm going to come up here to your frontal sinuses, and you tell me if you feel any tenderness or pain. Is that okay?
Mm-hmm.
Okay, and then I'm going to come down here to the maxillary sinuses. Any tenderness or pain? Okay. All right, next is your cranial nerve for your facial nerve. Can you smile? Frown? Puff out your cheeks? Okay. All right, and your face looks completely symmetrical. Everything looks normal. All right, so now I'm going to look at your lymph nodes.
Okay.
Okay, so there's preauricular up here, postauricular back here, occipital back here, submandibular under here, submental under here, and then we're going to look at your supraclavicular right here. Everything feels normal. Can't feel anything, which is normal.
Good.
Okay. Now I'm going to palpate your carotid arteries one at a time. Okay. Okay, now I'm going to look at the range of motion of your neck. Can you tilt your head back and bring your chin down to your chest, and then side to side? All right, good job. All right, I'm going to look at your trachea, and everything looks normal. It's midline as it should be. Okay. I'm going to look at your accessory nerve, cranial nerve 11, and I need you to shrug your shoulders against the resistance in my hands. Okay, good job. Alright, I'm gonna move to your eyes. I'm gonna take my gloves off. Alright. I'm just going to, it probably looks a little funny, so don't be scared. But I'm going to pull up here and just take a look under your eyelids and down here to make sure there's no redness, no drainage, anything like that. And everything looks good. We would be assessing visual acuity, which is the Snell and eye chart, but we don't have one in here right now, so we'll just skip that for now. I am gonna take my pen light and I'm gonna look at your pupils.
Okay.
Okay, just look directly at me. All right. Do it one more time, okay? Okay. They look good. They're equal, round, reactive to light and accommodation.
Good idea.
And then I'm gonna look at the 6 cardinal positions of gaze. So I just need you to look at this and follow where I go, okay?
Okay.
So I start up here. And back here. There. Okay. Good job. Alright, we're going to move on to your ears. I'm going to look just at the outside and make sure everything looks normal. Then I'm going to take my otoscope and I'm going to look inside the ear canal, okay? Alright. Your canals are clear and your tympanic membrane is pearly gray, which is normal. Next we're going to do a whisper test. So I'm going to stand on each side of you and I'm going to back up. I'm going to whisper one word and if you hear what I say, I just want you to repeat it back to me, okay? Okay.
Green.
Okay. Now we'll come over here and do the same thing.
Yellow.
Okay, good job. Okay, now we're gonna move on to your nose. And I need you to take a finger and cover one side of your nostril and sniff up for me. Okay, other side, same thing. Okay, so everything's patent. And then I have something for you to smell. Just close your eyes and you just tell me what it smells like.
Hand sanitizer.
There you go. All right. Now the last part of the nose, I'm just gonna take a look inside. Everything looks normal. No deviated septum. Normal mucosa. And actually, I'm gonna use this for your mouth too. So if you just want to open, can you stick your tongue out? Can you raise it up, down, side to side? Okay, everything looks normal. Can you swallow for me? Any pain, anything like that? Okay. All right. This. All right, I'm gonna look at your back and listen to your lungs, okay?
Okay.
Can you start out and take a deep breath for me? Okay, everything looks symmetrical. Do you have any pain when you breathe in?
I do not.
Okay. I'm gonna take my hands and I'm gonna run them up your back and you tell me if you have any pain or tenderness, okay? Is that okay?
Yep. No pain.
All right, I'm gonna listen back here. Just take a deep breath. All right, left upper lobe sounds good. We'll move to the right upper. Take a deep breath. Okay. I'm gonna come to right lower, and left lower. Okay. We're gonna move to the front. All right. We'll do left upper lobe. You can take a deep breath. And then right upper, same thing. And then I'm gonna move to the left lower. I'm gonna do the right middle. And then right lower. All right, lungs sound really good. No abnormal lung sounds. I'm gonna do the cardiovascular system now. So I need to check your fingers. There's no clubbing in your nails. Your capillary refill's less than 3 seconds, which is good. I'm gonna move up here and I need to check skin turgor. It's normal. Okay, so the point of maximal impulse is down here. It's at the 5th intercostal space down, mid-clavicular line, left sternal border.
Okay.
So that's here, and everything feels all right, feels normal. Okay, so up here on the right side of the 2nd intercostal space of the sternum is the aortic area. Left side is the pulmonic at the 2nd intercostal space. And then move down, and there is the tricuspid, the 4th intercostal space, left side. And then mitral is down at the PMI, 5th intercostal space, left sternal border. Everything sounds good. The S1 is best heard over the apex of the heart. The S2 is best heard over the base. Okay, I'm going to assess all your pulses just to make sure everything feels okay. We'll start at the brachial, which is up here. Okay, we'll do radial. And then your femoral is up here in your thigh, but we don't need to look at that today.
Okay.
And then popliteal is the back of the knee. Okay. Posterior tibial down here at the ankle. And then your dorsalis pedis, the top of the foot. Okay. All of your pulse points feel normal, 2+, no issues. Do you do your self-breast exams at home?
I do.
Okay. So they say to look for the 4 main breast cancers. You can do it sitting or lying down. So if you do it sitting up or standing, just put one arm behind your head. You can start at the clavicle, and you can either move in circular motions or you can just palpate straight down with 2 to 3 of your fingers. And you want to work your way all the way to the middle and make sure you remember the axillary area. You're looking for a lump that feels hard, doesn't move, or feels unusual. You're looking for a rash that looks and feels like the dimples of an orange peel. You're looking for any nipple discharge, but only by looking and not by squeezing. Okay, all right, I'm gonna have you lay back. And I'll pull this out so you're comfortable.
Okay.
Okay. Alright. I'm just going to make sure your abdomen is symmetrical and everything's okay. Do you have any issues that you can think of down here? Alright, we're just going to start by listening. to the vowel sounds. We're going to start over here in the right lower quadrant. Right upper. Left upper. Left lower. Okay, everything sounds good. All your vowel sounds are normal and active with all 4 quads. Alright, I'm going to lightly palpate all 4 quadrants, and then I'm going to deeply palpate all 4 quadrants, okay? Tell me if you have any tenderness or pain or anything like that, okay? Any issues?
No.
Okay, now we're going to deeply palpate, okay?
Mm-hmm.
Alright, everything looks good there. I'm going to push this in, and I'll have you sit up. Alright, now I'm going to look just at your lower extremities.
Okay.
I'm going to make sure that everything is symmetrical and you don't have any issues.
Mm-hmm.
I'm going to check right here and make sure that you don't have any edema. Okay. Any tenderness or pain?
No.
Okay. All right, we're going to move on to the neuromuscular.
Okay.
So you're just going to do a lot of stuff that I tell you to do, okay? All right.
That's good.
All right, so I'm going to say 3 words. These are numbers, and I just want you to immediately repeat them back to me, okay? So 8, 14, 23.
8, 14, 23.
Okay. Okay. Now I have 4 unrelated words.
Mm-hmm.
I'm going to say them, and then don't repeat them back to me now. Just remember them, and then I'll ask them to you later, okay?
Okay.
Okay, so there's sock, blue, bed, mouse.
Okay.
Okay. All right, I'm going to look at your remote memory.
Mm-hmm.
Can you tell me who the first president of the United States was?
George Washington.
Okay. Good. Okay. So now we're going to do tandem walking. So I'll have you stand up right here,
Okay.
and then as best you can walk heel toe as many steps as you can take, okay?
Okay.
And keep your balance.
Okay.
Okay. All right, you can hop back up there. All right. I'm gonna look at the range of motion in your extremities.
Okay.
Okay. Can you stick your arms up to the side?
Yeah.
Can you bring them in front of you?
Mm-hmm.
Can you flip your hands over? Flip them back? Can you bring? Yep. All right. Same thing with your legs. Can you straighten your legs out? Okay. And then I'm going to push up on your toes, and I want you to try to push them to the floor, okay?
Okay.
Okay, and then I'm going to push down, and I want you to bring them to you. Okay. Then same thing with your hands. I'm going to have you hold them out, and I'm going to push down, and you push up, okay?
Mm-hmm.
Okay. Okay. I push down. All right. Okay. Now I'm going to have you stand back up.
Okay.
I'm going to have you put your legs together
Okay.
and hands by your side. And then I just want you to close your eyes and just try to hold your balance. Okay. All right. You can get back on the table. Okay. Can you take your fingers and just touch your fingers to your thumbs? Okay. Now can you take each of your index fingers and just bring it right to your nose? Okay. Can you take your left heel and run it down your right shin? And then opposite. Okay. Can you squeeze my hands? Okay. And what are those 4 words that we talked about?
Blue, sock, bed, mouse.
Okay, good job. All right. Well, you're done with your assessment and